Welcome to Accelerate My Practice. So glad you're here to join me today. Today I want to talk a little bit about case acceptance, and I want to interview a patient who had an interesting experience with a doctor. And it's all about how can you inspire your patients to accept treatment. And I actually want to start sort of in true fashion with a little video on persistence. It's quite humorous, I think. And I think it's very, very germane to this topic of getting patients to accept health as an alternative versus procrastinating and paying more and being in a worse place. So watch this video. It's like 45 seconds long, and we'll come back and we'll chat.
Don't break that thingy. There you go.
Now climb up, right, boy.
You're done. Yeah, slowly. Don't lose it now.
You're not going up backwards.
Oh, there you go. Pet tater. That was good.
I love about that video is the fact that it demonstrates someone who's not willing to give up, or someone who's just spaced out, not paying attention to the camera, but someone who will not give up on what the goal is they're trying to achieve. Obviously, the goal that you're trying to achieve is improving your patient's health. They don't always understand that. So I want to bring in a guest here to discuss the experience that just happened yesterday during a cleaning. So if you could so kindly share with us kind of the background story as to what went on, what was said. Fill us in a little bit.
Sure. I had a regular cleaning scheduled yesterday with my dentist, and they asked me if I had been experiencing any difficulties, and I shared with them how I was having a little bit of intermittent pain in my upper left tooth. And so they pulled up my X-ray from 6 months ago to see if they could see anything there, and did a comparison bite wing to look at 6 months ago and today, yesterday. And what she saw was a little bit of extra gray shading, which I didn't understand what that was. So when I asked her for more information, she showed me the two different X-rays, and she said, well, there's a little bit more on this X-ray from that X-ray, and I think you might have a cavity, and it would probably be a good idea if we got that taken care of.
And how did you respond?
Well, I have a lot of dental anxiety, and so all of that fear came up for me, and I thought of all the different reasons why I did not want to do this. And so I said, well, how long do you think, can I let that go?
Normal sort of procrastination response?
Mm-hmm.
Yep. And how did she respond to that?
She suggested again that it might be a good idea that we take care of that.
And what did you hear as you're listening to what the doctor's telling you with all of this definitive diagnosis? What were you hearing?
What I heard was that it wasn't important, I heard words like might and could and possible and maybe, and I wasn't motivated or willing to do anything about that at that time.
So what's really neat to me is to have gotten to hear how someone advocated for themselves, which most of your patients will never do. Most of your patients are just going to walk up with that response of, nope, sorry, whatever. I got to think about it will be the excuse you're going to hear. So this is, when you hear a patient say, I need to think about it, this is what they're hearing you say, and this is what they're thinking. And this is what you've heard me talk a lot about, the type A person versus the passive person. You know, the passive person says, I'm going to think about it, walks out. You have to tell them again in 6 months when it's a lot bigger and a lot worse. And I always talk about the example of the aggressive person who does something different. And I always use the example of me. Well, in this case, we're going to get to hear what another assertive, might be a better word, person, how they responded.
So she saw my hesitation, and I point blank said, I don't want to do anything about this right now if it's not that important. And I pointed out, I said, I'm hearing you say words like maybe and might and possible, and that I think I could delay treatment. I asked a little bit more about what would happen if I did delay treatment, and she told me there was a possibility that I could have a root canal or a crown, which those are scarier. So when I shared with her the words that I was hearing from her, she rephrased and said, let me try again. And she then said, you have a cavity and you need to get it fixed sooner than later, or you will need a root canal or a bridge or a crown. And I went out to the front office and scheduled an appointment.
Awesome. And I think it's important that we can hear stories from patients. It's not very often I get a patient I can bring in here, get permission to share, put in the awkward spot of sitting in front of a camera, which they've never done, where they get to listen to me talk a million miles an hour and they're like, who in the world are you and why do you care? And why am I sharing the story? So it's kind of a unique experience for us to be able to have a real person in here sharing what it sounds like to them. You also had shared with me an experience where they said that they didn't have a panoramic X-ray on file for you. Can you share that story?
Yes, I walked in and the hygienist and the dentist were looking at my records and she said, I just noticed we don't have a pan on you and I think it would be a good idea if we had one. And my first question was, well, how much does that cost? Because I wasn't necessarily prepared to pay extra money since I pay cash. So she said, well, I'm not sure. I'll ask the front desk and I'll get that information for you. And at that point, I did not see any value in just having a panoramic X-ray on file, nor exposing myself to additional X-rays. So I did not participate in that plan.
So they never shared with you what the value of a pan was, why you should get a pan, why they wanted a pan, other than they wanted it on file.
Correct.
Interesting. So as we can hear, there's such a huge gap here between what you as clinicians know is useful, what's helpful, and allows you to be diagnostic. I mean, she didn't get to hear anything about oral cancer, cysts, any sort of soft tissue stuff that could be going on. Heard no value of any of this, nothing to do with 3D radiology. This office, I happen to know, doesn't have 3D radiology, so that's not even an option. But missed all the value of why a panoramic X-ray would be useful, helpful for them to understand what's going on with, her health. And it's just fascinating to me, again, to get to interview somebody who, you overhear a conversation, you're like, oh, please, tell me, please. You will come in here and volunteer and be a bit of a sucker in front of, however many people are listening. I don't want to share that because it could scare more. But, to have them in and be able to hear these stories is so profound to me. And like I said, we don't often get that. Was there anything else that stood out to you in your experience in dentistry in general, this appointment, this doctor, which we won't name? Any other germane information you can share?
Other than just when I'm in the office, I hear my own anxiety and my fear, and I don't often hear the importance of what they're trying to communicate to me. So I need very direct communication to get through my fear and my anxiety of additional treatment.
Sure, totally fair. Have you ever switched dentists before?
I have.
Can you share with us why you might have?
It was a logistical thing. Location was part of it, but also the cost of the services. When I was able to find a lower cost alternative that worked with my family and my schedule, I decided to switch.
And was the lower cost, did it come to fruition? I mean, did it actually be a real cost savings for you? Or, did you think there was going to be some cost savings and it turned out maybe there wasn't?
I think the actual prices of services ended up being the same, but the less of a burden on my schedule.
Gotcha. So the thought as to why you were going to switch originally was cost savings, turned out not to be, but became a great justification. Is that a fair way of putting it?
Yes.
Okay, fair enough. Not to put you on the spot, I apologize for that. But it's always good. Again, how often do I get to interview somebody? And I'm curious, when you were looking for a new doctor, how did you find one? Did you ask people in town? Did you ask for references from people who might be knowledgeable? Did you just randomly throw something at a dartboard?
No, I asked friends and family, other people who live in the neighborhood that I was wanting to have a convenient location for a dentist. I happen to have a friend in the dental business who sells dental supplies, and so I inquired with him as well and determined if there was a recommendation that he would make based on his experience with working in the dental industry.
Sure. Did you Google search, Facebook, do any of the social media stuff? Because that's where everyone wants to go spending all their money in order to find new patients. Did you use those tools, or was it purely off recommendations?
It was off of recommendations.
Interesting. No shocker, I don't think, to many of us. But it's interesting to me how many people want to go out and buy new websites and do social media and pay-per-click and all this stuff, only to then find out, hey, your patients being your biggest fan are the greatest reason why they might refer or at least affirm that you're somewhere they want to go. And it's interesting to hear that geography plays a role. I think that's a super common bit of feedback for people. It's no shocker, I think, to hear that price becomes an issue. Was there any sort of connection or disconnection with the past doctor or staff that played a role in any of this?
I felt that the doctor wasn't really, I don't know if this is a good term, but warm, just a comfort level in hearing his opinion and what's going on with my health and how I was feeling. There wasn't a connection to any anxiety or fear that I had, and so the new dentist that I switched to, I felt more comfortable communicating that.
So if I grossly oversimplify this, having a doctor who has got a warm, inviting personality plays a big role in all of this, as opposed to someone who, let's face it, some of our doctors out there in dentistry, and we've all worked in various offices, so we've all had an experience at some point in our career where we've worked with a doctor who might have been a little robotic, and maybe even some of you doctors listening to this might have been an associate in a practice where the doctor was a little bit robotic, and that might be why you ended up leaving, setting up your own practice. And so what I'm hearing from you, especially as a female patron, that having a connection to your healthcare provider was of great importance to you.
Very much so, yes.
And then was the gender, or were there other things that played a role for you as a female patron?
My previous dentist was male. He just wasn't super warm. There wasn't a connection there for me. And the current dentist that I have is female. And I feel more comfortable with her.
Go girl power for all you lady doctors out there watching right now. Kind of fun stuff. Sammy's giving us the high five, saying this is awesome. So anyway, it's just great to have the opportunity to be able to interview somebody. I'm very, very appreciative of you coming in here, being vulnerable, sharing some of this with our clients out here watching this and getting to learn. And I think asking patients periodically things like this, exit interviews, if you will, if you ever have patients leaving, hearing some of this information. Now, will a patient share it on their way out? Maybe not, maybe, hard to say. Certainly you'll never know if you don't ask. Getting a real, raw, honest answer, probably a little tough. Again, why I think it's so valuable to have an opportunity like this. So, I think the bottom line is we got to remember we're not treating teeth. And I know all of you who go to dental school, who are great technicians, to you it's teeth, right? You want to save the tooth. And I think the greater connection is going to be to the human, the person you're dealing with, around the tooth, to where they can feel comfortable, relaxed. You're hearing a great deal of anxiety in this message. And obviously not everybody's a dental phobe, but I'd say more probably are than aren't. And so I think we really need to make sure that we're treating the person. And I know that's a topic that we hit a lot here, and it's great to hear somebody who's an outsider coming in and going, yeah, maybe the other person was even a better technician in terms of treating my tooth, because it sounds like this experience recently did not portray confidence from a diagnostic perspective, and all these things are a big, big challenge. So, I hope you guys found all this to be useful, and, rather short show, some humorous horse video. I'm thinking about doing a horse video on dentistry. Anyway, fun stuff. You never know what's coming from us. Just got to keep it interesting. So I appreciate you taking the time to be with us, and I appreciate everyone here who's watching us. I can't wait to see you again next week, 8 o'clock Mountain, 10 o'clock on the East Coast. Until then, have a great week. What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.